Have you noticed parts of your skin being darker than the rest of the body? This is why. I'm Dr. Grace, a dermatologist in training. Osobola okumpita omusawo w'okulususu oba skin doctor. Sister Boni. So, most cases, there are several causes of skin hyperpigmentation, but I'll mention a few because of time in this video. The first one is the sun. The sun tells your body to produce more melanin. But then there are also these invisible rays that we cannot see with our eyes, but the body seriously notices them. These are the ultraviolet radiations, the UVR. And there are several types, but I've mentioned only 3, actually 2, because the UVC is absorbed by the ozone layer, it doesn't get to our skin. But then the UVA is that penetrates deep. It has a wavelength of about 320 to 400 nanometers. So when it goes through the epidermis to the dermis, it causes some damage to your collagen and elastin. This is what leads to photoaging because your collagen is disturbed, elastin, and you end up aging faster than it should. And the other is the UVV. Now this has a shorter wavelength of 280 to 320 nanometers, and it only goes to the epidermis, but it causes things like sunburns. Let me tell you a short story. I have a friend who is black, just like me. But one time we're in this hustle looking for houses, and then guess what happens? She ends up with burns. They're like, what happened? What happened? Obviously, I was a 4th year by then. I didn't know what sunburns are. And this, now that I know, if I relate the story, I can remember it was actually UVB effects. So, and then when you add both, you can still get sunburns, photoaging, hyperpigmentation, but worse, skin cancer. Anyways, we go back to hyperpigmentation. I guess you see how the hyperpigmentation ends up happening because of the sun. The second cause is friction. More so if you're gaining weight, and that's why you find some areas like the underarms, the inner thighs, being the most areas affected by hyperpigmentation. Because of friction, your thighs are rubbing against each other. The other cause is drugs. There's some medications that we take, like, should I say the names? I don't want you to stop taking the drugs if you've been taking them, but just know there are some medications that if you're on them and you notice changing of color, you find yourself getting darker, consult with your physicians. Most of the tetracyclines like doxycycline, some antimalarials like hydroxychloroquine. I'll spare you the details, but if you've been taking some drug and then you notice you're just becoming darker, consult with your physician. It could be a side effect of the drug. The other cause is hormones. Now this one, most of the pregnant women, if you're watching and you're there, cyber hugs, because I know what you're going through. There are several hormones. There's a lot of hormone surge that happens when you're pregnant. It's not only pregnancy, also some family planning methods. The hormonal ones lead to hormonal increase, and in this video I'll talk about the melanocyte stimulating hormone, because this one directly tells your body, your cells, to produce more melanocytes. And when the melanocytes are so high, when they increase in number, end up with hyperpigmentation. So there are several other causes of hyperpigmentation, but those are some of them. Thank you so much for following up the end. If you want more about dermatology conditions, please comment. I'll come and talk about whatever you want me to talk about. Remember, the right and health skincare starts with the right information. Bye.